it's good for a man to release maybe once or twice in a week. Yeah, people make jest of health matters. There's this jest or whatever. There's this jest that is going on. People think or people say that in the case of prostate cancer, that you need to be having a constant sexual encounters to be free from that. Well, it's true, but people have to know why, the reasons for that. Now, most of the times, the prostate is a gland that is inside the male organ, the male body, and it's like it has 3 lobes there, and its work is mainly to give fluid to the sperm when it is produced. Now, most of the times, this fluid is there, and then a man stays, it doesn't give out that fluid, it continues to accumulate. At times it can turn to another thing. Then another thing is that when a man now ejaculates, those fluid goes out. When those fluid goes out, the content of the prostate gland becomes a bit empty, and there's not much to cause problem. But when these things accumulate, the fluids accumulates, and the man is not giving them out, it can lead to more chances of having prostate cancer. Now, a man needs to ejaculate at least, a mature man, at least twice a week. When a man is younger, it can be more than that. The people make a jest of it and use it to make all kinds of jokes, all kinds of caricature, thinking that it's funny. It's not a funny thing. Now, another thing that can lead to that issue is constant prostatitis. Prostatitis that is the inflammation of the prostate gland, which can occur from infection coming from the male organ. Infection ascends and gets to the prostate. Now, the funny thing is that most of the times, most of the antibiotics don't reach the prostate gland. At the end of the day, the prostatitis continues. And when you do the prostate specific antigen, the PSA, the estimate, it goes high because of the prostatitis. So, but what I'm trying to advise to you is that once in a while, a man that is having active sex life should go and see his doctor for his prostate health. Prostate health is very important. There are some drugs that a doctor can give you that can take care of prostatitis. Prostatitis is a problem. It's a very big problem. And then having poor sex life leads to the accumulation of fluids in the prostate. And this can lead to escalation in etiology of cancer in the prostate. So it's good for a man to release maybe once or twice in a week, above 50. Not that somebody will now start going out of his way to look for women, different women. At the end of the day, by the time you meet different women, you may be prone to have prostatitis, which is another danger. So going out with different women is not a solution, because it can give you more problem than the solution you are seeking for. So let's be careful what we talk and what we gist with, or what we make as a jest. Please, it's important you release, but release with the right people. The people will not give you prostatitis. Prostatitis on its own is a problem. And it's doctors that will give you the right antibiotics. It's not something you can just go and pick and take. You may not get it right. So just go to your doctors when you notice any of those signs. Make sure you go for treatment or for your prostate health. Just go to the doctor and say, I want to take care of my prostate. The doctor knows what to do. As I always say, make sure you do your PSA level once in 6 months or twice in a year, especially when you are above 50. It's very important. It's very important. It's life-saving. As I always say, the more knowledge of your health you have, the healthier you live. Make sure you keep a date with us on this page and follow this page. If you have not been following it, go to that place in that page, check where they say follow it. You get more insights in your health. Thank you.